All right, get ready, because today we're going deep on something that hits close to home for me.
Oh.
Spine injuries in aging athletes.
Okay.
We're breaking down a chapter from a medical textbook
Right.
all about conservative and operative management and return to sport.
Sounds intense.
It is, but don't worry.
Okay.
This isn't just for the pros.
Right.
Whether you're a weekend warrior,
Yeah.
or maybe you're just starting to feel your age a little bit on the tennis court,
Mm-hmm.
understanding how to keep your spine healthy,
Yes.
that's crucial for anyone who wants to stay active for years to come.
For sure. For sure.
So that's what we're talking about today.
I'm excited.
So
Yeah.
our source material kicks off with something that I think we've all dealt with at some point.
Oh, yeah.
Back pain.
The universal experience.
Universal experience.
Yeah.
And actually a whopping 85% of us will deal with back pain at some point in our lives.
Wow.
That's a crazy statistic.
It really is. And for athletes especially, those of us getting a bit, shall we say, seasoned, back pain can be a major roadblock.
For sure.
But
Yeah.
here's the thing.
Yeah.
The research really emphasizes that staying active
What?
is actually one of the best ways to prevent and manage back pain.
That's counterintuitive.
It seems that way, right?
Yeah.
But there's solid science behind
Because
it.
I was thinking, like, if my back hurts,
Right.
wouldn't moving it more make it worse?
Not necessarily.
Okay.
Think of your spine like the suspension system in a high-performance car.
Okay.
Regular exercise,
Yeah.
particularly targeted strength training and flexibility work.
Yeah.
It helps keep those shock absorbers healthy.
Mm-hmm.
Those are your intervertebral discs
Okay.
functioning optimally.
Got it.
And it also strengthens the muscles that support your spine.
So it's like reinforcing the chassis.
Exactly. You're building a more resilient structure.
Okay. That analogy makes a lot of sense.
Good.
So we're talking about preventative maintenance here,
Exactly.
not just reacting when things go wrong.
That's the key.
And for aging athletes, that's got to be especially important
Yeah.
because we naturally start to see some wear and tear
Absolutely.
on those spinal structures.
Wear and tear happens.
It does.
It's part of life.
Speaking of wear and tear,
Yeah.
the chapter dives into this condition called spinal stenosis.
Oh, yeah.
Can you break that down for us?
Sure.
What's actually happening in the spine when someone has spinal stenosis?
So spinal stenosis is basically a narrowing
Okay.
of the spaces within your spinal canal
Mm-hmm.
where the spinal cord and nerves run.
Yeah.
Imagine a tunnel getting smaller and smaller.
Okay.
That's what's happening to the nerves in your spine.
So it's like a traffic jam
Yes.
with all those nerves getting pinched.
That's a great way to visualize it.
Okay.
And this can lead to a bunch of unpleasant symptoms
Gotcha.
from numbness and tingling,
Mm-hmm.
weakness,
Yeah.
pain, particularly when you're active.
Especially if you're trying to, get out there and do your thing.
Right, exactly. Yeah. Now, it's important to note that there are different types of spinal stenosis,
Oh, really?
each impacting athletes in kind of unique ways.
Okay.
So, for example,
Yeah.
foraminal stenosis.
Yeah.
That affects the nerve roots as they exit the spinal column,
Got it.
while central stenosis involves narrowing of the central canal,
Okay.
potentially impacting the spinal cord itself.
Oh, wow.
So different types of stenosis.
That's really interesting for our athlete listeners because if you're dealing with stenosis,
Yes,
understanding the specific type,
Right.
that can help guide treatment
absolutely.
and inform how you modify your training.
For sure.
So the chapter emphasizes that when it comes to treatment,
Yeah.
conservative management is often the first line of defense.
Yeah, we try to start there
Okay.
if we can.
So the conservative approach seems to be a recurring theme here.
It often is.
Is that always the starting point?
In many cases, yes.
Even for something as serious as spinal stenosis?
It can be.
Okay.
This might involve physical therapy, tailored to your specific type of stenosis,
Okay.
pain management strategies,
Mm-hmm.
and modifications to your training regimen.
So working with a physical therapist to kind of decompress those nerves,
Yeah.
strengthen supporting muscles,
Yep.
ultimately keep you moving safely.
Exactly.
But if those conservative measures aren't providing enough relief,
Right.
or if there's signs of neurological damage,
Yeah, but we got to look at other things.
then surgical intervention might be necessary.
Might be.
Okay, so surgery is always on the
It's
table,
there if we need it.
but it's not the automatic go-to.
Right.
It really depends on the individual case
All right.
and how they respond to the conservative management.
Absolutely. Key takeaway.
Got it.
Now, before we move on to another common spinal issue,
Okay.
intervertebral disc disease,
Yeah.
let's touch on a specific surgical procedure often used for cervical stenosis,
Okay.
ACDF, or anterior cervical discectomy and fusion.
Okay, that one sounds intense.
It can be.
What exactly does ACDF involve?
It's a procedure where the surgeon accesses the spine from the front of your neck,
Okay.
removes the damaged disc,
Mhm.
and then fuses the vertebrae together to stabilize the spine.
So you're gaining stability,
You are.
but you're potentially losing some range of motion in that area.
That can be the trade-off.
Yes. Okay.
But for athletes with severe cervical stenosis,
Right.
that added stability can be life-changing.
Yeah.
Allows them to return to activities they love without debilitating pain
Right.
or risk of further damage.
It sounds like weighing the pros and cons
Yeah.
is crucial when you're considering any type of surgery.
Absolutely. It's a decision that should always be made in consultation with your medical team,
Yeah.
taking into account your individual circumstances,
Yeah.
your goals, and the specifics of your condition,
For sure.
your whole situation.
Now let's shift gears to those intervertebral discs.
Okay.
Those shock absorbers we talked about earlier.
Yeah.
The source material uses this vivid analogy
Oh, yeah.
to describe disc degeneration. It's like a jelly donut losing its filling.
I like that.
Can you paint a picture of what's happening there
Sure.
and why it matters, especially for aging athletes?
So imagine a plump, juicy jelly donut.
Okay.
That's your healthy disc.
Got it.
But as we age,
Yeah.
these discs can start to lose their fluid content,
Oh, great.
becoming drier,
Okay.
less resilient.
So they're not absorbing shock as effectively,
Exactly.
which means more stress on the spine.
Right.
Brr.
And this degeneration can begin earlier than you might think,
Really?
sometimes even in our 20s and 30s.
Wow, I didn't know that.
It's a natural part of aging,
Okay.
but certain factors
Yeah.
like genetics, lifestyle, and repetitive stress, those can accelerate the process.
So those high-impact activities that a lot of athletes love
Yeah,
can actually contribute to a faster disc degeneration.
that's right.
Wow.
And this can lead to a range of issues.
Yeah.
From general back pain
Mhm.
to more serious problems like disc herniations.
Okay, so let's talk about herniations. Okay.
I remember the basic concept from high school biology.
Right.
It's when the disc bulges outright.
You got the basic idea.
Okay, but can you give us a more nuanced understanding?
Yeah.
Especially in the context of aging athletes.
So a herniation occurs when the gel-like center of the disc pushes through the outer layer,
Wait.
kind of like that jelly squeezing out of a donut.
Okay.
Now, these herniations,
Yeah.
they can occur in different parts of the spine,
Okay.
most commonly in the cervical spine, your neck,
Right.
and the lumbar spine, your lower back.
Got it.
So different areas.
And the location of the herniation impacts the symptoms, right?
Absolutely.
For example, a cervical herniation might cause pain,
Yes.
numbness,
Uh-huh.
or a weakness that radiates down your arm.
That's right.
Whereas a lumbar herniation could lead to similar symptoms in your leg or foot.
Exactly.
Knowing the type of herniation helps guide treatment right.
It really does.
So let's talk about what options athletes have.
Okay. It does help. Yeah. So let's kind of break down those options.
Okay.
What are the initial steps when an aging athlete
Right.
is diagnosed with a disc herniation?
Yeah.
Whether it's in the cervical or lumbar region.
So typically, just like with spinal stenosis, we start with a conservative approach.
Okay.
Rest-modified activities.
Okay.
Over-the-counter pain relievers.
Mm-hmm.
See if we can just manage those symptoms.
Right.
Give the body a chance to heal.
Strategic downtime.
Yeah.
Pain management.
Uh-huh.
But what about physical therapy?
Physical therapy can be a real game changer,
Okay.
especially for aging athletes.
Yeah.
It's not just about addressing the pain. It's about strengthening those core muscles,
Right.
improving flexibility,
Okay.
and promoting proper movement mechanics
Yeah.
to take pressure off that affected disc.
So you're building a support system for that area.
Exactly.
Almost like creating a natural brace through targeted exercises.
That's a great way to put it.
Yeah.
And there's a growing body of research on rehab protocols that are specifically tailored to aging athletes,
Oh, wow.
taking into account the unique changes our bodies go through as we get older.
That's fantastic.
Yeah, it's exciting research.
Now, the chapter makes it clear that surgery isn't always the answer.
Right.
How do doctors decide when it's absolutely necessary?
That's a good question.
Yeah.
So if an athlete has really diligently followed the conservative route,
Mm-hmm.
but their pain is still debilitating,
Yeah.
or they're experiencing what we call progressive neurological deficits,
Okay.
things like muscle weakness, loss of sensation,
Wow.
issues with bowel or bladder control.
So it's not even just about pain management at that point. It's
Not
about
yet.
preventing irreversible damage.
Exactly.
Okay.
And even then, it's a collaborative decision
Yeah.
between the athlete, their surgeon,
Right.
our entire medical team.
It takes a village.
It really does.
Okay, so let's assume surgery is on the table. Okay. What are the common procedures for disc herniations?
So you've probably heard terms like discectomy and fusion thrown around.
I have.
Can you explain what those actually entail?
Please.
A discectomy involves removing the herniated portion of the disc
Yep.
to relieve the pressure on the nerves.
Mm-hmm.
Think of it like carefully trimming away
Okay.
the part of that jelly donut that's squeezing out.
I like that analogy.
And then fusion.
Yeah, when is that necessary?
Fusion is often performed in conjunction with a discectomy,
Okay.
particularly in cases where the spine is unstable.
Got it.
So it involves permanently joining two or more vertebrae together
Okay.
using bone grafts and often metal implants.
So it's like creating a bridge between the vertebrae.
Yes.
Providing that stability,
Oh.
but potentially limiting some range of motion in that area.
That's right.
It's a trade-off.
It is a trade-off.
Now, I imagine the recovery process for spine surgery,
Oh, yeah.
especially for aging athletes, can be quite extensive.
It can be quite a journey.
What are some of the key challenges that these athletes face during rehab?
Well, there's the physical healing process, of
Mhm.
course, regaining strength,
Mm-hmm.
flexibility, range of motion.
Yeah,
That all takes time and dedicated effort.
of course.
But there's also the mental and emotional aspect.
Right.
We talked earlier about how an athlete's identity is often intertwined
Yeah.
with their sport,
Yeah.
their physical capabilities.
Absolutely.
So facing a potentially lengthy recovery
Yeah.
with uncertainties about returning to their previous level of performance
Right.
can be a real psychological hurdle.
For sure.
It can be tough.
It's like there's this unspoken pressure to suck it up
Right.
and just focus on getting back to peak performance.
Yeah, you got to push through it.
But, we're talking about human beings here
Absolutely.
with complex emotions.
Yes.
And a deep connection to their
A
sport.
deep connection, yeah.
Yeah.
So acknowledging those emotions is the first step towards healing.
Yeah.
Creating a safe space for athletes
Mm.
to express their fears, their frustrations, their
Yeah.
grief over what they've lost
Yeah.
without judgment.
It's about validating their experience.
Exactly.
Letting them know that it's okay to feel those emotions.
It's normal.
It's a normal human response
Yes.
to a significant loss.
It is a loss.
And providing them with the tools and resources
Yes.
that they need to navigate this challenging terrain.
Absolutely.
So that might involve connecting them with support groups,
Or could.
mental health professionals who specialize in sports psychology,
That's a great resource.
or even just encouraging open conversations with
Mhm.
family and friends.
Those are important too.
Yeah.
Your support system.
It's about fostering a culture of support
I agree.
where athletes feel empowered to prioritize their mental health
Yes.
alongside their physical recovery.
It's all connected.
And it's about recognizing that this journey of healing is holistic.
Absolutely.
It's not just about fixing the physical injury.
Right.
It's about supporting the whole person,
The whole person.
mind, body, and spirit.
I love that.
Speaking of journeys,
Yeah.
let's shift our focus to that pivotal moment.
Okay.
For any athlete recovering from a spine injury,
Return to play.
return to play.
Easy.
This is what it all boils down to, right?
That's your goal.
Getting back in the game,
Mhm.
even if it looks a little different than it used to.
Right.
But how do doctors determine when an athlete is ready?
So many factors to consider.
Seems like a lot.
It is.
Yeah.
We'll look at factors like pain levels,
Okay.
range of motion,
Mm-hmm.
strength stability,
Yeah.
neurological function.
Wow. Okay.
We'll review imaging studies
Yeah.
to see how the injury has healed.
Okay.
Consider the demands of the athlete's specific sport.
So I'm thinking about different sports and how they kind of stress the spine.
Right.
Does the return to play strategy change a lot
It can.
depending on the sport?
A marathon runner, for example,
Yeah.
will have different demands on their spine than a golfer or a swimmer.
Of course. Makes sense.
So the medical team will take those nuances into account
Right.
when tailoring the rehabilitation plan
Yeah.
and setting realistic expectations for return to play.
The chapter mentions that while many athletes can return to some level of activity,
Yeah.
their performance might not be the same as it was before the injury.
Right.
That's got to be a tough pill to swallow.
It can be a tough reality.
Yeah.
This is where the mental game comes in.
Yeah.
Athletes often have to adjust their expectations,
Right.
focusing on progress, not perfection.
Mm-hmm.
Maybe they won't be as fast
Yeah.
or as powerful as they once were,
Right.
but they can still find joy
Yeah.
and fulfillment in the sport they love.
It's about adapting, evolving,
It is.
and maybe even discovering new strengths
Yes.
and passions along the way.
It's about celebrating those small victories, those
Yeah.
milestones on the road to recovery.
Now, before we wrap up this segment,
Well-
I want to touch on something that I think is often overlooked in discussions about athletic injuries.
What's that?
The mental health aspect.
Okay.
We've touched on it briefly,
Yeah,
but I think it deserves its own deep dive.
I agree.
How can aging athletes who often define themselves by their physical prowess
Right.
cope with the psychological impact
Mhm.
of a spine injury
Yeah.
and the potential need to redefine their athletic identity?
That's a critical question.
Yeah.
We often focus so much on the physical healing process
Right.
that we kind of neglect the emotional and psychological toll
Yeah.
these injuries can take.
It's almost like there's this expectation
Yeah.
to just power through.
To toughen up.
Yeah.
Yeah,
But acknowledging those emotions,
I think so.
that's the first step toward healing.
It is.
Creating that safe space
Yes.
for athletes to express those fears,
Uh-huh.
frustrations,
Yeah.
that grief over what they've lost.
The loss is key.
Yeah.
And providing them with the tools and resources they
Yeah.
need to navigate
Yeah.
this challenging terrain.
Absolutely.
That might involve connecting them with support groups.
Yeah.
Mental health professionals who specialize in sports psychology.
That's great.
Or even just encouraging open conversations with family and friends.
That support system is huge.
It really is.
It's about fostering a culture of support
Yeah.
where athletes feel empowered to prioritize their mental health alongside their physical recovery,
It's all connected.
and recognizing that this journey of healing is holistic.
Absolutely.
It's not just about fixing that physical injury.
Right.
It's about supporting the whole person,
Yes.
mind, body, and spirit.
That's it.
Okay, we've covered a lot of ground in this segment.
We have.
From the nuances of treatment to the complexities of the return to play process, the importance of mental health.
A lot of important stuff.
Let's take a quick pause to let this all sink in.
Okay.
When we come back, we'll wrap things up
All right.
with some final reflections on the challenges and triumphs of aging athletes facing spine injuries.
Looking forward to it.
And we'll leave you with a thought-provoking question to ponder.
Sounds good. Stay tuned.
Uh-huh.
Welcome back to the Deep Dive. We've been on quite a journey,
We have
exploring the world of spine injuries in aging athletes.
lots to talk about.
From the biomechanics of back pain to
Yes,
the
yes,
complexities of surgery
And
the often overlooked emotional side of recovery.
it's all connected.
It really is.
It is.
Now, as we wrap up, I want to
Yeah.
kind of shift our perspective
Okay.
and consider the bigger picture.
Societal context.
Yeah, like the societal context.
Interesting.
Because I think there's a real opportunity here
Okay.
to challenge some assumptions about aging and athleticism.
What do you mean?
Well, we live in a culture that often equates youth with peak performance
It's true.
and kind of relegates aging athletes to the sidelines.
Yeah, we see that a lot.
It's almost like we have this collective fear of
Yeah.
aging, this aversion to,
Yeah.
the natural decline.
In physical capabilities that comes with time.
Like it's a bad thing.
But what if we embraced aging
Okay.
as a process of transformation
I like that.
rather than decline?
Instead of seeing aging athletes as less than,
Right?
we could celebrate their experience, their resilience, their wisdom.
Imagine a world
Yeah.
where aging athletes were seen as these valuable mentors, role models,
Yeah.
sources of inspiration.
Not just for younger athletes,
Yes.
but for society as a whole.
I love that.
A cultural shift.
Where athleticism isn't defined by age
Right.
or physical limitations.
And about the passion,
Yeah.
the dedication,
Yeah.
the joy of movement.
And where we support aging athletes,
Yeah.
not just in their pursuit of, physical excellence, but also in their transition to new roles, new identities as they navigate
Yeah.
the evolving landscape of their athletic journeys.
That's powerful.
It's recognizing that an athlete's identity doesn't have to end
Right.
with a particular performance level
Doesn't have to.
or a certain age.
I can evolve, transform, find new expressions.
This has been such a great conversation,
I agree.
and I hope our listeners are walking away
Yeah.
with a deeper understanding
Uh-huh.
of the challenges
Yeah.
and the triumphs
The ups and downs.
of aging athletes
Absolutely.
facing spine injuries.
And hopefully a broader perspective
Yeah.
on how we can better support
Yeah.
and celebrate these incredible individuals.
I think so too.
It's been a privilege to share this deep dive with you and our listeners.
And on that note,
Wait.
we've reached the end.
The end of our exploration.
But before we sign off,
Okay.
I want to leave you with a final thought
All right.
to ponder.
I'm ready.
We've talked a lot about physical healing.
Yes, we have.
But what about healing as a transformative experience?
Ooh, that's deep.
How can we reframe these challenges of aging and injury as opportunities for growth, for resilience, even self-discovery?
A new perspective.
Something to think about
It is.
as you continue your own journey
Yes.
of exploration and movement.
Beautiful.
Thanks for joining us on The Deep Dive.